Hey team, it's Dr. George Forgan-Smith here. I am a GP based in Melbourne's CBD. We in Melbourne are currently in a stage 4 lockdown, and this is for our protection to reduce the contact between people to reduce the transmission of the coronavirus. Now, you may have been contacted by an allied health professional, whether that be a physio, an osteopath, a chiropractor, an acupuncturist. The DHHS has mandated that if you are going to leave your home to see an allied health professional, the ones I mentioned before, then you do need a referral from your GP. While this sounds like an arduous task to have to do, and let's face it, the GPs are busy and this is an additional burden on your GP, it's for a reason. And it's an opportunity for you to stop and to think about the risks associated with this treatment. I've already had a number of phone calls in regards to this, and the conversation that I have with my patients is as such. I want them to be able to weigh up the risks and benefits of the treatment. Does the feeling and the improvement that you get from your treatment, is that more than the potential risk of exposure to the coronavirus? I want you to consider important things like, how far will you have to travel to get this treatment? How long will you be in the room to get the treatment done? For example, 2 people in a closed space for 15 minutes or longer is considered a close contact for the coronavirus. That's one thing. How long will you have to wait in the waiting room? How many people do you have to pass in the process of doing that? Will your practitioner be wearing a mask? Will you be wearing a mask? And if that's such, what safety precautions are in place to protect you both? Please don't think I'm trying to talk you out of getting treatments if they give you a really good quality benefit. But it is vital that you have completely thought out all of the particular aspects of this treatment before you go and do it. You need to do it with a clear, well thought out consent towards the treatment, understanding the current circumstances that we are in. The reason that the DHHS wishes you to have this conversation with your GP is to help you go through this process and for you to decide whether that treatment is worth the potential risk for your health. Another option, if you don't feel confident in leaving the home, is to talk with your practitioner. Are there exercises that you can do at home? Are there stretches that you can do at home? Are there additional measures that you can put in place that do not require you leaving the house? These are all important things to be able to talk with your practitioner about. Could it be done over a Zoom meeting? That's a lot of potential. Whilst physiotherapy can be very hands-on and chiropractor is extremely hands-on, there are some things that can be done through a supervised Zoom session. Again, these are all options that you can talk not only with your practitioner about, but also with your GP. So please stay safe. Wash your hands, socially distance, and stay at home unless you're leaving your house for one of the 4 reasons. And please, when you leave, wear a mask. Stay safe, look after yourself, and look after each other. We will get through this. I wish you the best.